Well, Mission Lifeline is the American Heart Association's program to assist hospitals and health systems in developing comprehensive integrated systems of care. These systems of care are designed specifically to improve patient outcomes for patients with acute myocardial infarction, STEMI specifically, and now patients who have suffered out of hospital cardiac arrest. I think over the past year and a half, there have been tremendous accomplishments in Mission Lifeline. I think most importantly, we have extended the reach of Mission Lifeline, that is the coverage. And at this point, about 65% of all patients, all people in the United States are covered by a Mission Lifeline system. In addition, I think the second most important accomplishment over this past year has been the launch, the very successful launch of Mission Lifeline resuscitation. So now that these systems are developed for STEMI care, heart attack care, they can be leveraged into caring for patients who have suffered an out-of-hospital cardiac arrest. And hundreds of thousands of people every year, unfortunately, suffer out-of-hospital cardiac arrest. And unfortunately, the outcomes of those arrests are not what they need to be. Mission Lifeline specifically focuses on improving outcomes through a systematic approach, including community outreach, community training, EMS participation, hospital participation, and advanced cardiac life support applied to all those patients. I think Mission Lifeline represents a wise investment. What it means is that the community, the EMS providers, and the entire health system are now integrated, working seamlessly, and the cost of this is minimal, quite frankly, and the payoff is huge. The reason for that is that Mission Lifeline, through the American Heart Association, has really developed many of the tools, techniques, principles that are required to build these systems. One does not have to start from scratch and invest heavily in making a system that works in the community. Rather, the American Heart Association has really provided a blueprint or a roadmap as to how to do that. Now, it's true that every health system is unique, every community is unique, but there are certain guiding principles that can be invoked each and every time, which will accelerate that process of sound investment. I think in the future of Mission Lifeline, which by the way is very bright, the recognition of the absolutely essential resource of EMS is now very, very clear. What we realized was that the EMS services are, first of all, unbelievably important to communities, often under-recognized, quite frankly, underappreciated, and very much underfunded. And I think what we're hoping to do is bring together that EMS community, provide them with protocols, provide them with support, and to give you guidance in terms of guidelines, in terms of what is best care, and indeed how you can improve that care. So lots and lots of information available once you're signed up for Mission Lifeline that help you and your community provide better care for patients with ST elevation MI, with out-of-hospital cardiac arrest, and coming soon, multiple other diseases.